Hello, my name is Angie King. My persuasive research paper is about giving pain medication to someone that is presenting addictive behavior. In the hospital, this type of patient is known as frequent flyers or drug seekers, and a stigma is placed fairly quickly upon their names as somebody that is not truly in pain or that they're just seeking the high of the medication. As a registered nurse, this topic is very dear to me, and there are varying opinions between physicians and nurses. Every patient that is in the hospital, whether they're in the emergency room or they're admitted to a unit at the hospital, they are asked to rate their pain on a scale of 0 to 10. 0 being no pain, 1 to 3 being minor, 4 to 6 being moderate, and 7 to 10 being severe. There's been many articles and studies done over the past 30 years, and there really has been little to no change in regards to pain management in the hospital. Eloise Carr, author of Understanding Inadequate Pain Management in the Clinical Setting, states that it's actually the healthcare professionals that you meet the most resistance with, that they are not willing to make the changes and go against the flow. Working in the hospital, I can see that this could be a problem because, some people or hear the word change and they resist. But as, healthcare professionals, and the world changes from minute to minute, we need to be adaptable to the most recent evidence-based research. The article, An Ethical Responsibility for Pain Management, written by Laura Kopp, it discusses how physicians write the orders for pain medication, and those orders are then up to interpretation of the nurses. When this happens, it's kind of a moral judgment for the nurse, and at that point, his or her bias can become an obstacle to overcome, and it's regarding what they feel the patient is in, if they're in severe pain or not. Dr. Haddad, the author of Ethical Problem of Poor Pain Management, builds off of this issue for nurses making the judgment call, and reports that nurses are loyal to physicians and other nurses, and they just don't want to go against the flow or question how the medications are ordered. I personally feel that as a nurse, you need to be a patient advocate. And if the patient is saying that they are in pain, then you need to believe them and give them, the pain management, the medications that's going to help them. Dr. Michael Weaver has also written an article called Opioid Treatment of Chronic Pain in Patients with Addiction. And in this article, Dr. Weaver basically calls out the physicians and states that, they need to learn more of how to schedule pain medications and how they do their assessments and the different drug dependencies. He also says that, even though a patient has an addiction, they could still be in pain, and they need to be treated as such, that it is real pain and medication does need to be given. But while the nurses are fighting with the dilemma of giving pain medication to someone they feel is drug seeking, there is another article written by Kay Tassot's Patients' Perception of Pain Management and the Use of Coping Strategies. It brings forth the overuse of pain medication and that it's actually not helping these patients with their addiction, and that complementary alternative medication known as CAMs is actually more useful. CAM treatment is, but not limited to, yoga, therapeutic touch, acupuncture, and reflexology. I think that we need to all understand that patients are coming to the hospital now with more comorbidities than ever before. And as healthcare providers, we need to take notice of this change and adjust our assessments to ensure that proper patient care is given to everyone, no matter if the patient is considered to be a frequent flyer or not. The same care all around needs to be given. This concludes my presentation. I hope you enjoyed the information and feel free to ask any questions. Thank you.